I'm Roseanne Tracy, and welcome to the Morning Report. You might have noticed some feral animals around your home, work, or even your local cafe. You might have noticed that some of them seem odd or more vicious than usual. Rabies may be the cause for this epidemic. More on this from our reporter in the field, Jehovah Smith.
Thanks, Roseanne. I'm here in Kaiser Hospital with Dr. Tavasia. She's going to tell us a few things about rabies.
Rabies is a virus that is spread through an infected animal's saliva. If you are scratched or bitten by a wild animal, you have a possibility of contracting the disease. Although human spread of rabies is rare, it can happen through organ transplants or being bitten by the human carrier. Some signs and symptoms of the rabies virus may start out as those similar to those of the flu, such as weakness, fever, headaches, and discomfort. The symptoms may then become more severe over time, with an itchy feeling around the area where you were bitten, cerebral dysfunction, anxiety, confusion, agitation, delirium, abnormal behavior, hallucinations, and insomnia. There is no treatment for rabies, but there are some steps that can be taken. It is helpful to thoroughly wash out the bite with soapy water and then receive immediate medical attention from your doctor. If the doctor decides that you have a risk of contracting the virus, you'll be given 5 preventive vaccines over 28 days. The best step would be to give you the human rabies immunoglobulin vaccine the day you're bitten.
Well, thank you, Dr. Tavasia. Back to you, Roseanne.
Animals. We will now head back into the field with our reporter, Jehovah Smith.
I'm here with a rabies specialist, Margaret Stiles, and she's going to speak a few words about rabies.
Thank you for having me. Some information that you may want to know about rabies is that they can be transferred through infected saliva when it is introduced to the body. It is usually transmitted from animals to other animals, or on some occasions, humans when bit, or rarely when nervous tissues enter an open wound or saliva. For animals, symptoms from rabies start to appear from 4 up to 5 days after exposure of the virus. For humans, symptoms from rabies start to appear from as little as 14 days to up to a year.
Thank you, Jehovah. To conclude our newscast, I would like to share with you a few more important things to know and some precautions you should take. You can prevent contracting rabies by vaccinating your pets against the virus whenever it is required, starting at 4 months and returning each time your pet needs a booster shot. Keep your pets under control, make sure that they are supervised when they go outside, and do not let them roam around. Avoid wild animals as they may have the virus and are more likely to transmit the disease. Do not take any wild animals in. Even animals born in captivity may carry the virus. Another way to prevent contracting the virus from wild animals is to make your home unappealing to these animals. Block off spots where the animals might hide and make sure your doors are locked and windows are closed at night. If you encounter a wild, warm-blooded animal in your house, contact animal control and do not engage. Even after contracting the virus, you still need to be vaccinated. Raccoons are the biggest carriers of rabies. All warm-blooded animals are affected by the virus. It is most common in wild animals such as raccoons, foxes, bats, dogs, and skunks. This is Roseanne Tracy, and thank you for watching. Have a good night.
And I'm here with the rabies specialist, Anisha Solomon. She's going to give us some more information.
I love this song.